Did you know that most strokes don't actually happen suddenly? That image we all have of someone collapsing out of the blue is dangerously incomplete. The truth is, strokes often send quiet signals, little warnings that most people, especially after age 60, simply overlook. Every year, hundreds of thousands of seniors experience strokes. And afterward, so many of them say the signs were there all along, but they just didn't recognize them in time. Experts in brain health and aging tell us that our bodies often send these subtle warnings days, or even weeks, before a major stroke occurs. The problem is, these early signs don't feel dramatic. They pop up during the most ordinary moments of your day. Maybe you're brushing your teeth, buttoning your shirt, or pouring your morning coffee. You might notice a small change, something that's easy to brush off as just getting older. But it's not. Think about it. Your brain controls every single precise movement your body makes. So, when your coordination suddenly feels a little off, even just slightly, it can be a sign that blood flow to your brain is being disrupted. Maybe your hand misses the toothbrush. Maybe a little bit of tea dribbles from your lip. Or your fingers suddenly feel clumsy, even though they aren't numb or paralyzed. These are neurological signals, not just normal aging. Doctors often share stories of healthy seniors who start noticing they're dropping their keys more often, or fumbling with buttons, or even briefly forgetting simple words. There's no pain, no dizziness, no headache. But when they get a brain scan, it reveals a small warning stroke, a transient ischemic attack, or TIA. And here's the crucial part. When these little events are caught early, we can intervene and prevent a massive, life-changing stroke from happening. In fact, research shows that the first 48 hours after these subtle signs appear are the most critical. If you get treatment within that window, your risk of having a severe stroke can drop by more than 80%. Just being aware of these signs can save brain tissue, and it can save lives. Now, let's talk about timing, because it's incredibly important. Experts emphasize that the most dangerous period for a stroke isn't during a stressful afternoon. It's actually in the very first hour after you wake up in the morning. Why then? Well, overnight, your body becomes dehydrated. Your blood naturally thickens. As dawn breaks, your body releases a surge of stress hormones, and your blood pressure rises. For anyone with aging arteries, this combination creates a perfect storm for a stroke. And if you combine this vulnerable window with a few common morning habits, the risk can quietly multiply. Let's break down 5 of these habits that experts say everyone over 60 should avoid. The first risky habit is skipping water first thing in the morning. So many people wake up and go straight for their coffee. But experts warn that after 6 to 8 hours without any fluids, your blood is thicker and much more prone to clotting. Studies have actually linked low morning hydration to nearly half of all first-time ischemic strokes. The recommendation from specialists is simple. Drink 1 full glass of room temperature or warm water immediately after you wake up. Do this before your coffee, before your medication, before you even look at the news. This isn't about quenching your thirst. It's about restoring healthy circulation to your brain. The second habit to watch out for is staying still for too long after waking up. Lying in bed, scrolling on your phone, or just sitting there motionless allows blood to pool in your lower body. This reduces the amount of blood flowing up to your brain. In older adults, this morning stagnation can be a trigger for a serious event. Experts advise doing some gentle movement within minutes of waking. Simple things like rolling your ankles, flexing your toes, doing some shoulder circles, and then standing up slowly. Just 2 minutes of this can safely restart your circulation and get blood moving where it needs to go. Third is the habit of skipping breakfast. While different fasting methods might be popular for younger people, specialists caution that for those over 60, especially if you're on medication for blood pressure or diabetes, skipping breakfast can increase your risk of low blood sugar. Your brain absolutely depends on a steady supply of glucose to function properly. You don't need a huge meal. A small, protein-rich breakfast is enough. Half an egg, a little bit of yogurt, or a handful of nuts can stabilize your blood sugar and protect your brain during this vulnerable time. The fourth risky habit is rushing straight into stress. Checking the news, diving into your emails, or getting into a tense conversation right after you wake up causes your cortisol and blood pressure to spike. This happens during your body's most fragile hours of the day. Long-term studies have shown that this kind of early morning stress significantly increases stroke risk in adults over 60. The solution: create a calm buffer zone after you wake up. Maybe it's 10 minutes of light stretching, a short, gentle walk, or just sitting quietly. This isn't a luxury. It's a form of neurological protection. And the fifth habit, which is probably the most overlooked, is overall physical inactivity in the morning. Spending the first few hours of your day sitting down slows your circulation and increases the risk of blood clots, and this is true even for people who exercise later in the day. Research has found that prolonged morning sitting can actually double the stroke risk in older adults. So, make sure you incorporate some light movement into that first hour. Walk around the house, do some simple stretches, or just march in place for a few minutes. This signals to your body that the day has begun. When your blood is flowing, your brain thrives. At the end of the day, experts agree on one thing: maintaining your health after 60 isn't about making extreme, difficult changes. It's about paying attention to the small signals your body sends and being mindful of your daily rhythms. Your body is always communicating with you. The real danger begins when we stop listening. Thank you so much for watching. If you found this information helpful, please share it with someone you care about.